practitioner and practice manager for Comprehensive Women's Healthcare. We're located in Grapevine, Texas, inside Baylor Regional Medical Center. We have 3 doctors, 2 nurse practitioners, and 1 radiology technician. We see about 500 patients a week here at this location. We have 1 location. We were probably like most practices where we had very long wait times, patients filling out numerous pieces of paper that delayed their office visit quite substantially.
I would be here waiting for them, and it may be 30 minutes into their appointment time, and where is the patient? And oh, she's still filling out paperwork.
Long waits to get in, and lots of phone calls to answer. And in fact, we have 3 nurses dedicated to nothing but phone calls. So we first started with voicemail type stuff and more employees. And then we thought, well, there's got to be a better answer to this.
We were very excited to see all the products that Medfusion had to offer because they encompassed every part of our patient care, whether it was their billing or their messaging or their prescriptions or their registration. On the practice side, efficiency has been the key. So making the patient registration process more efficient, making the refill requests more efficient. I'm just trying to save the time of the nursing staff, the time of the front office staff, and the time of the billing staff.
Online bill pay has made my job a lot easier. The patients don't have to call in. They can do it at their own leisure. We don't have to spend that time on the phone with the patients, getting their credit card information or whatnot. We also, our billing costs are down because we're sending out less statements. Patients are paying immediately when they get that statement because they can.
You've done away with all the phone calls, which are so time consuming for everybody.
In the field of gynecology, we do have to ask a lot of personal questions that are very pertinent to their medical history and can help us take better care of them. And I think it's a lot more private using our portal system so that they can be comfortable in their home instead of answering these questions in a doctor's office.
So the patient can utilize their time away from the office to work on their refill requests and appointment requests, and then when they're here they can spend more time with the providers. Once we signed on with Medfusion, we really started the marketing to our patients immediately. I felt that was really important to make sure that the patients were ready when we were ready. Every office staff wore a button that says, "Coming soon, our online services." We did little patient card handouts. We had business cards made that they were given probably more than once in the office. So we had little business cards that highlighted the 6 services that we would be offering with our online services. We had a very large sign made for the waiting room. Now we call our patients, and when we verify their appointments, tell them to go register online.
We just now started printing on our statements our website that says pay online, save a stamp, log into our website, and we've gotten an overwhelming response from patients who would like to do it that way.
We sent out an email with patient messaging once the portal was up and running to say we're online, it's time to start registering. We've had 700 people register in the 8-9 weeks that we've been online, and that's why, because they were ready.
I have used the online features. I've done a check-in, I've ordered prescriptions. I think it's great.
I had a lady that had called my nurse and had wanted to switch from her birth control pills over to an injection. And I had asked that nurse, well, we can do that, however, I need to sit down and talk to this patient about the risks and the benefits of the medication. And my nurse turned to me and said, you have no time. You're full. And so our answer to that was a virtual office visit, and it was successful. We could come back and have an online conversation, and it was successful, and she was able to take the injectable, and she felt fully informed.
Patients who have used the virtual office visit are uniformly positive about it. They love it. They did it from work, they did it from home, they did it at night from their computers at the house, and they love it. They've been very happy with it. We haven't had any complaints at all.
Personally, I think it's great that technology is being able to be used to help make our lives easier. And it was nice to know I was talking to my own physician instead of just someone else out there that didn't know anything about me.
I think there's no doubt that right now patients have a choice where they get their health care, and being in cutting-edge technology really makes them think that, if they have cutting-edge technology, they probably give cutting-edge health care.